Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the introduction of the Pancreatic Cancer Coaching Program. My experience has been that most newly diagnosed cancer patients don't know that they don't know. When I was first diagnosed in early 1994 with an incurable blood cancer called multiple myeloma, I had never even heard of my type of cancer. I knew little about conventional, integrative, and complementary therapies for my cancer. Like most newly diagnosed cancer patients, I spent the first months after my cancer diagnosis working through my anger, fear, and grief. I assumed my oncologist had my health under control. I was wrong. Please understand that conventional oncology is an important component in the life of all cancer patients. However, I now understand that in order to manage a complicated disease like pancreatic cancer, the newly diagnosed patient must look to all possible forms of evidence-based research and think beyond surgery, chemotherapy, and radiation to manage his or her cancer. Keep in mind that, according to the American Cancer Society, the 5-year survival average for pancreatic cancer is only 7%. Keep in mind also that averages can be misleading depending on your stage of diagnosis, age, overall health, and therapies you choose to pursue. Since the launch of People Beating Cancer in June of 2004, I have researched and written about pancreatic cancer at all stages. In 2018, I decided to curate and create a specific cancer coaching program for pancreatic cancer patients, survivors, and caregivers. I created the Pancreatic Cancer Coaching Program in order to give newly diagnosed pancreatic cancer patients and caregivers the experience, research, and information that I believe they need to manage an aggressive disease like pancreatic cancer. Since 2004, I've researched and created more than 135 studies, papers, and articles for pancreatic cancer that, when combined with my own long-term experience, addresses my old regret if I knew then what I know now. A diagnosis of pancreatic cancer requires dozens of life-changing decisions in the days, weeks, and months following the words, "You have cancer." The Pancreatic Cancer Program gives you the research, information, and survivor experience you need broken down into those topics and issues that research indicates will help you fight your cancer. No single guide, no single therapy is a silver bullet. The Pancreatic Cancer Coaching Program is designed to work as an all-encompassing lifestyle going forward. The 15 guides included in the program are as follows. Pancreatic cancer facts, definitions, terms. There's a certain amount of jargon that oncology uses to discuss your cancer. You'll need to understand these or have access to definitions simply to talk to your oncologist. Pancreatic Cancer First Questions Guide, the Pancreatic Cancer Conventional or FDA Approved Therapies Guide, very important. The Pancreatic Cancer Side Effects Guide, no one dies of pancreatic cancer, you die of the problems that pancreatic cancer causes. It's important to understand possible side effects in order to possibly minimize or prevent them. There's the Pancreatic Cancer Antioxidants Guide, Pancreatic Nutrition Guide. Day-to-day nutrition, especially while you're undergoing therapy, is extremely important. The Pancreatic Cancer Supplementation Guide, evidence-based supplements that have been shown to reduce or actually kill pancreatic cancer, or cytotoxic to pancreatic cancer. There's the Pancreatic Cancer Integrative Therapies Guide, evidence-based, non-conventional pancreatic cancer therapies. Pancreatic Cancer Cannabis Guide. Cannabis can be an extremely useful therapy in your journey. Pancreatic Cancer Detoxification Guide. Pancreatic Cancer Mind-Body Therapies Guide, evidence-based mind-body therapies. Pancreatic Cancer Online Support Guide. There are a host of online groups that can be a tremendous resource to both the pancreatic cancer survivor and caregiver. Pancreatic Cancer Caregivers Guide. And finally, the Pancreatic Cancer Financial Issues Guide. I myself ignored all of my written communications from my health insurer probably for the first year of my own cancer diagnosis, and that was a big mistake. The financial toxicity of serious cancers is extremely important. Of course, there's also finally my ebook, Managing Cancer, If I Knew Then What I Know Now. The Pancreatic Cancer Coaching Program comes in both the basic and premium packages. Both packages include all 15 guides plus my ebook. I am making the basic package available to you based on what you choose to pay. It's called the Name Your Own Price system. Let me say that again. All 15 guides plus my ebook in the Pancreatic Cancer Coaching Program are yours based on what you choose to pay. Yes, the suggested price for the basic pancreatic cancer program is $49, but again, you decide what you pay. The benefit of the premium cancer coaching program is 3 months of online support directly with me. Some clients choose to ask me any and all questions about supplements, about guides, about the suggested therapy plan of their oncologist. No question is off the table, no question is too small. Ask away. All guides and the ebook are sent to you to your email address in a PDF format immediately after you complete the checkout process. Please take a moment to download the guides to your computer, as the links will expire after 1 year. There are dozens of links throughout the guides, access to the studies that I cite. All proceeds benefit peoplebeatingcancer.org, a registered 501c3 nonprofit, and are used to further our mission to empower cancer patients and caregivers to live longer, healthier lives. We have a 30-day, 100% money-back guarantee for all of our cancer coaching products and services. No questions asked. Please click the link below the video, down below, and remember that your purchase of either the basic or premium pancreatic cancer coaching program funds ongoing research for cancer patients, survivors, and caregivers. Thank you for your time.